Thank you for staying with us on the news this hour. Staying in the nation's capital, where the Nigerian Medical Association says the sordid state of the nation's health institutions and poor remuneration have contributed to the migration of many competent and qualified practitioners. At a public hearing on some health-related bills, the Parliament says it will continue to support the government in its quest to reposition the sector and end brain drain. National Assembly correspondent Joke Adisa reports.
The Committee on Health Institutions holds this interactive session to address some burning issues affecting the sector. They include proposed establishment of some health institutions, unethical conduct and abuse associated with surrogacy and child adoption. The committee says the nation must reverse the Japa syndrome and make Nigeria a hub for Africa's health solution. The dialogue session affords leading players in the sector.
Abuses are there because sometimes, even if there are laws today, I assure you, there will still be abuses or unethical practices. But let there be law to guide our practices so that things will work better.
To bear their minds on the state of the sector and suggestions for the way forward.
Asking for the establishment of a tertiary healthcare development fund, which would help in the provision of health infrastructure, medical equipment, and funding for research and training.
There is nothing in the Health Act that gives us legal guidance about who should be the legal parent of a child conceived with donor egg and donor sperm. There's nothing in our laws that tells us what procedures we need to put into place to regulate the indiscriminate donation of eggs and sperm. Our laws are silent. It is a lacuna.
In Nigeria, interestingly, we are one of the foremost providers of assisted reproductive technology in Africa. I dare say that Nigeria is the biggest provider of assisted reproductive technology in the whole of Africa.
From the lawmakers are words of encouragement and support to the nation's medical professionals. They say with the needed commitment, patriotism and dedication, the sector will become enviable across the continent in no distant future.
Away from